Welcome to Chapter 6, the Urinary System. So in this chapter, we're going to identify the functions of the urinary system, define terms related to the urinary system, look at word parts related to the urinary system, define some common medical terminology related to the urinary system, and look at abbreviations used in the urinary system as well. So first you need to know a little anatomy and physiology. So the functions of the urinary system are to filter waste products from the body and to regulate levels of fluids and electrolytes, as well to carry urine throughout the system until excretion. So here's some anatomy on the urinary system. Of course, you know the right and the left kidneys. Above those are the right and the left adrenal glands. In the middle of the left kidney, we can see the renal pelvis. And flowing down from the kidneys, we see the right and left ureters, ending in the urinary bladder. On the right-hand side is a more pulled-out picture where we can see the urethra leading to the urinary meatus. The organs and structures, so the kidneys remove waste from the blood in the form of urine. The ureters carry urine from the kidneys to the bladder, like we just saw, and the urethra carries urine from the bladder to the outside of the body. Again, the kidneys remove waste products from the blood. You need to know the nephron, which is the urine-producing unit in the kidney, the glomerulus, which is the capillary cluster in the nephron that starts the process of blood filtration. The renal pelvis, we saw that, which was the reservoir in the kidney that collects the urine, and the ureters, which carry urine from the kidneys to the bladder. Here's a cross-section of the kidney that shows the blood flow through it, the renal artery, the renal vein, and then the renal pelvis. Remember, that's where the urine is stored and pulled in the kidney till it's drained through the ureter. The urinary bladder is also called the bladder. It holds urine until it's released. The urethra is the tube in which urine travels from the bladder to the outside of the body. The urinary meatus is the opening from the urethra to the outside of the body. And the urine is composed of water, waste products, and other substances. Here's a picture of the bladder. So we see the ureters going into the wall of the bladder. The upper part of the bladder, kind of in the back there, is the fundus of the bladder. The bottom part is the neck at the bladder, and that leads out through the urethra. So when we talk about word parts, our combining forms are cysto, vesiculo, vesico, glycoso or glyco, hydro, and litho. So the cysto, vesiculo, and vesico is reference to the urinary bladder, glycoso or glyco for glucose or sugar, hydro for water or fluid, and litho for stone or calculus. Additionally, nephro or reno for kidney, nocti for night, oligo for few or scanty, and pio for pus. Pilo for the renal pelvis, uretero for the ureter, urethro for urethra, uro or urino for urine or the urinary system tract. Common prefixes that you might see are dis for painful, difficult, or abnormal, or poly for many or much. Common suffixes for this system are algia and dynia for pain, cella for herniation or protrusion, centesis for puncture to aspirate, emesis for vomiting, gen for origin or production, and graphy for the process of recording. Additional suffixes include ptosis for prolapse, drooping, or sagging, scopy for the process of examining or examination, stenosis for stricture, narrowing, stomy for surgical or opening, trypsy for crushing, and urea for urine or urination. So some adjectives and related terms include the word cystic, which means pertaining to the urinary bladder, genitourinary or GU, which means pertaining to the organs of the reproduction and urination. Remember from last week, the GI was gastrointestinal, but GU is genitourinary. The meatal is pertaining to the meatus. Micturition is the process of releasing urine from the bladder. Nephric is pertaining to the kidney. Urethral is pertaining to the ureter. Urethral is pertaining to the urethra. Urinary pertaining to urine. And urinate to release urine from the bladder. Some symptoms and medical conditions that are associated with the urinary system include terms relating to the presence of or substances in the urine. So albuminuria is the albumin in the urine, albuminuria. Bacteriuria is bacteria in the urine. Glycosuria is glucose in the urine. Hematuria is blood in the urine. Proteinuria is protein in the urine. And pyuria is pus in the urine. So those are all the things you might see when they do a urinalysis. Terms relating to urination are diuresis, that's a condition of excreting increased amounts of urine. Dysuria is difficulty urinating or painful urination. Enuresis is involuntary discharge of urine, and nocturia is excessive urination at night. Oliguria is a scanty amount of urine. Polyuria is an excessive and frequent urination. And stress urinary incontinence, or SUI, is the involuntary discharge of urine during coughing, straining, or sudden movements. Urinary retention is the abnormal accumulation of urine in the bladder due to inability to empty the bladder. Epispadias is a congenital defect in which the urinary meatus is on the upper surface of the penis. And hypospadias is a congenital defect in which the urinary meatus is on the underside of the penis. We're going to see a picture of those. So here in A, we see the normal urethral opening through the tip of the penis. The epispadias is where the urethral opening opens at the top of the penis, and hypospadias is where the urinary opening opens at the bottom of the penis. Terms relating to, these are symptoms and medical conditions that relate to stones or strictures in the urinary system. So a cystolith is a stone in the bladder. Hydronephrosis is the buildup of urine in the kidneys caused by obstruction of urine flow, and that's usually due to a stone or a stricture. A hydroureter is the buildup of urine in the ureters caused by obstruction of urine flow, and that's usually due to a stone or stricture. So here's a picture of the hydronephrosis and the hydroureter from a stone or a stricture, and you can see the buildup in the urine has caused disformation of the tissues and organs there. Nephrolithiasis is a condition of stones in the kidney. A renal calculus is also a stone in the kidney, and uretolith is a stone in the ureter. And here's some different pictures of those stones throughout the urinary system. The nephrolithiasis are stones in the kidney, and uretolithiasis is a stone in the ureter, and cystolithiasis are stones in the bladder going into the urethra. Diseases and disorders of the kidney that you're going to see are end-stage renal disease, or ESRD, and that's the final phase of chronic kidney disease. Polycystic kidney disease is a kidney condition in which many cysts occur within upon the kidneys, resulting in the loss of functional tissue. There's two types of renal failure. There's ARF, which is acute renal failure, or CRF, which is a chronic condition for chronic renal failure, in which the kidneys fail to excrete the urine. They can do it from either ARF or CRF. Here's a picture of a polycystic kidney. Remember, those were cysts all around the kidney. You see the healthy kidney on the left and the polycystic with all the cysts, poly meaning many, cysts on the kidney on the right. So what are some common laboratory tests associated with the urinary system? Well, BUN is a blood urea nitrogen, and that's a blood test that measures the amount of urine in the blood. A creatinine clearance test is a test done to measure the total amount of creatinine excreted in the urine. And HG is the specific gravity, and that's a test to measure the concentration of the urine. And a UA, or urinalysis, is a series of tests done to analyze a sample of urine. Additionally, some procedures of the bladder are the cystography. That's a process of making a radiologic recording of the bladder. A cystoscopy is an examination of the bladder by endoscopy, and an intravenous pyelography and IVP is a process of making an X-ray of the urinary tract after injection of a contrast dye into the bloodstream. Here's a picture of the cystoscopy going through, passing through the penis, the prostate, into the urinary bladder. Some additional diagnostic procedures of the kidneys include a nephrography. That's a process of making a radiological recording or X-ray of the kidney. Nephroscopy is an examination of the kidneys by endoscopy. And a nephrosonogram, that's a process of making a recording of the kidneys using sound waves. Common surgeries related to the repair or suturing of the urinary system are the cystoplasty, that's a repair of the bladder. Cystorrhaphy is a suturing of the bladder. Pyeloplasty is a repair of the renal pelvis. Ureteroplasty is a repair of the urethra. Some procedures related to dialysis. So the first is hemodialysis. That's the removal of waste products from the blood by pumping the blood through a machine that works as an artificial kidney for those people that have lost the function of their kidney. Peritoneal dialysis is the removal of those waste products in the blood or the impurities from the body by using the peritoneum of the abdominal cavity as a filter. So here's a graphical representation of hemodialysis. You see the fistula, the blood being pumped out through a hemodialyser, blood flowing into the dialysis membrane, and then back in through the fistula. Here's peritoneal dialysis. A solution is put into the abdominal cavity or peritoneal cavity where the dialysis occurs in the blood by the type of solution. The catheter removes it and the old solution comes out. Common surgeries associated and procedures for removal of stones is a cystolithotomy. That's an incision into the bladder to remove a stone. And extracorporeal shockwave lithotripsy, an ESWL, is breaking up the renal or the uteral calculi by focused ultrasound energy. And nephrolithotomy is an incision into the kidney to remove a stone. And a pyelolithotomy is an incision into the renal pelvis to remove a stone. Common medications and drug therapies are antibacterial, used to destroy or prevent bacteria. Antibiotics act against the susceptible microorganisms. A diuretic increases the amount of urine secreted, and urinary analgesic relieves pain within the urinary system. The specialists are nephrologists, a medical specialty focusing on the study and the treatment of kidney conditions, nephrology, and a nephrologist is a physician who specializes in nephrology. Urology is the medical specialty focusing on the study and treatments of conditions of the urinary system, and a urologist is the physician who specializes in urology. Common abbreviations again: ARF, acute renal failure; CAF for catheter; CRF, chronic renal failure; ESRD, and